name's Brooklyn Reeves, and I'm doing awesome.
Awesome. And you just finished 5 sessions of Prolotherapy?
Yes.
Okay.
Finished 5 sessions. He did injections of, I believe, a dextrose solution with I think 2% lidocaine or something.
Correct.
Into my right hip, and then also a bunch around my lower back and sacrum.
Okay.
So yeah, I did 5 sessions, and after the first session, I felt a little bit of improvement. It wasn't a ton, but after the second, third, fourth, and fifth sessions, I was able to feel like my nerves were calming down a lot, so it wasn't so much of a chronic pain thing. It was more like if I was sitting for over 30 or 40 minutes at a time, or driving or standing in one place, the pain would kind of start to creep in. But in terms of my range of motion and feeling like I had more sensation in my back, even just to touch, and then also kind of being able to control my tilting my pelvis back and forth. Before, I was having a lot of catching when I would tuck my pelvis under. It was like my muscles or my nerves or something were trying to work in the proper way but couldn't. But after the second to fifth session, I feel like I gained all of that back, which is really awesome. I dance professionally, so having range of motion and control over my body is a huge thing, and it's actually lower back and hip pain is something that I've had for a few years, but after this last car accident in September of 2018, it all just came back tenfold. But this whole prolotherapy thing was a saving grace, so I'm super happy that I was able to do it, and I would recommend it to anybody that has chronic pain or has tried different options for healing soft tissue injuries and hasn't been successful with it. It's really an amazing thing. And
was there any part of the process that surprised you, of the entire treatment process?
How quick it was. In terms of the needles and stuff, I'm not a huge fan of needles, and I was a little nervous, but I have a pretty high tolerance for pain. It's just no one ever is oh yeah, this is gonna be great. So once we got into it, Dr. Meyer was really good at telling me what he was doing, and just letting me know, here comes the alcohol, this is only alcohol, now you're gonna feel a little pinch because I'm numbing your skin, and then he would talk me through every time a needle was about to be going into my back or my hip.
Okay. And if you could think of a percentage improvement from when you first started the treatment to where you are now, what percentage would that be?
So as of today, I would say I'm about 97% better. I think the last 3% is just the sitting or standing or driving for a long time, which is pretty normal. Our bodies are not meant to do that. So, but the things that are most important to me are dancing and exercising, and when I'm doing that, I feel great. I don't have any pain at all. So.
Yeah. Okay. Yeah, and that was my last question. So thank you very much. Okay.
Yeah.